bringing a detailed summary of Chapter 9 of the Art Therapy Handbook. This chapter mainly discusses the different views on art creation and art therapy from major psychoanalytic scholars such as Freud, Klein, Milner, Winnicott, and Jung. The core issues revolve around how art becomes an important way to assess the unconscious, deal with internal conflicts, symbolize emotions, and promote self-integration. The chapter starts with Freud's classical psychoanalysis, then introduces the British object relations school, for example, Klein, Winnicott, and Milner, as well as Jung's theories of symbolism and archetypes, explaining the function and significance of art in different psychoanalytic approaches. First of all, let's talk about the phrase classical psychoanalytic view. Art as an expression of the unconscious. Freud believed that art creation could transform unconscious conflicts, desires, and dream symbols into socially acceptable forms, known as sublimation. He distinguished between the primary process related to dreams, symbols, and unconscious drives, and the secondary process corresponding to logic and the reality principle. Freud noted that both art and neurosis involve dealing with internal conflicts, but art can limit these conflicts into more constructive forms. Studies on Da Vinci and Michelangelo. Freud's analysis of artists such as Da Vinci and Michelangelo attempted to reveal the role of childhood experience and the unconscious in the creative process. Carolyn emphasized the infant's early interaction with the mother, the primary object, proposing the concepts of the paranoid schizoid position and the depressive position. In art creation and art therapy, Klein's viewpoint is often used to understand how individuals symbolically destroy objects and then attempt to repair them to relieve internal conflict and guilty. The Kleinian school believes that artistic activity allows unconscious impulses of aggression and repair to be expressed on a safe symbolic level, helping individuals achieve better self-integration. Milner emphasized the spontaneous ordering force in the process of drawing or creating, believing that color and light can directly reflect emotions and the unconscious. She focuses on the potential spiritual dangers triggered by the creative process, suggesting that deep artistic practice can lead to inner transformation and self-integration. Milner viewed drawing as an intermediary space where individuals explore between fantasy and reality, thereby promoting psychological growth. Winnicott proposed that infants form a safe intermediate zone between the self and the mother through transitional objects such as dolls or blankets. He emphasized the importance of play for the psychological development of children and even adults. Art creation is seen as a higher level of play that facilitates self-expression and self-integration. Winnicott believes that only in a sufficiently safe environment can individuals develop a true self and freely exercise their creativity. One of the key reasons jokes diverged from Freud was his introduction of the collective unconscious and archetypes, positing that artwork can contain shared human symbolism. Jokes believed that creation should promote individuation, helping to integrate consciousness and the unconscious, that the transcendence function guides people to find a new balance between opposing emotions. In clinical practice, jokes encourage clients to depict dreams and symbolic imagery through drawing, sculpture, and other forms to more deeply engage the unconscious and facilitate psychological growth. Although Freud and jokes have differing core viewpoints, and the British Object Relations School focuses on mother-infant integration, play, and symbolism. All these schools highlight the importance of art in assessing the unconscious, dealing with conflict, and promoting self-integration. The status of art in psychoanalysis is very important. Art is not merely an exhibition of aesthetic or technique, but also a pathway to inner emotion and primal impulses, allowing people to express and understand themselves symbolically. In practice, therapists often combine different psychoanalytic theories, choosing appropriate interventions according to clients' needs and responses, such as interpreting symbols, providing a safe play environment, and encouraging spontaneous creation. Through arts, clients can sublimate negative emotions or unconscious conflicts into a more creative and malleable rhythm, thereby achieving psychological growth and healing. Chapter 9 explores core concepts such as the manifestation of the unconscious, object relations, symbolism and play, and individuation in art creation and therapy from multiple psychoanalytic perspectives. These theories collectively show that art is an expressive pathway that transcends transcends language barriers, allowing clients to explore themselves symbolically and creatively, and to attempt the integration of internal conflict in a safe environment. For arts therapists, understanding these theories can help them more sensitively perceive the needs of their clients and more flexibly use art materials and symbolic activities in therapy, thereby facilitating individual psychological growth. That's all for today. Thank you for watching, and we look forward to seeing you in the next chapter and video.